Hi, my name is Chelsea Fulford, and I recently received stem cell therapy in both of my knees. When I reached out to inquire about the stem cell therapy, there was a lot of information that was given. I felt very informed about the procedure prior to coming in. When I got here, Mike, he spent probably 20 minutes just explaining the procedure, explaining his experience with the procedure, and made me feel very comfortable about what I was about to endure. And then after the procedure, he was very informative. He spent the time telling me exactly what I should and shouldn't do. They followed up with me that evening. They followed up with me within a couple of days. It's a very hands-on practice, which I don't feel a lot of medical offices are these days. So it just made me feel very comfortable and very confident about the care I was receiving. My right knee is stage 4 osteoarthritic, bone on bone. So I was able to receive the injections, and I'm about 9 weeks post-procedure. And I have definitely noticed a big improvement in the amount of grinding in my knee. I have minimal to zero at this point. And the biggest improvement in an activity of daily living would be negotiating stairs. So going up and down stairs has been much easier and less painful for me. I've done 3 Ironman, and I've done several marathons and triathlons. For the last 4 or 5 years, I've been receiving the Stemedix injections, and the knee is still very much limiting me in what I would like to be able to do as far as running and strength training. And so when I met Fred and they were telling me about the stem cell therapy and how it could prevent me from my next surgery being a knee replacement, which is what I was told by the orthopedic. So obviously I was all on board with that. Yeah, so I've had 2 knee surgeries. I've had ACL replacement, I've had arthroscopic surgery because I injured it when I was very young, and it's just over time. I've done triathlons, marathons, and just really wore down that right knee. The left knee is pretty good, but we did it in both knees to help prevent the arthritis in the left knee. And I just noticed just such a big improvement with being able to squat down, go down a stair without having all of that grinding. It wasn't immediate. It definitely was closer towards this 8-9 week mark that I was like, whoa, I don't feel any grinding in my knee at all. So that's a huge improvement. I would say within the first couple of weeks, I did notice more range of motion, which obviously now I'm noticing even more. But I wasn't really testing the boundaries because there was a protocol of not doing deep bends in the knee, not doing anything high impact. So I wasn't really testing the waters to notice. Other than the restrictions of activity, there was no downtime. I was able to go stand on my feet at work for 8 hours a day with no pain, no limitation. So definitely 10 out of 10 recommend.